Are you doing the straight leg raise after ACL reconstruction surgery? You may be doing it wrong, and we're going to go over in this video how to do it correctly to make sure you're feeling the right muscles that we need to activate during the straight leg raise. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So when it comes to the straight leg raise, it's one of the most popular exercises that are prescribed after ACL reconstruction surgery. The reason being is that it's in most of the protocols that surgeons give out to the patients, and usually in PT, that's one of the exercises they make you do. The straight leg raise is when you lift your leg off the ground to try to keep your knee straight and try to activate your quad. And we're gonna break it down why you're actually doing it incorrectly, and you might not even be targeting the right muscle that you need to be using during this exercise. To be perfectly honest, not a big fan of the exercise. There's different exercises I like instead, but because this is the most commonly exercise prescribed after ACL surgery, we're just gonna make sure that you're doing it correctly. So let's jump into it. All right, guys, so let's go over the straight leg raise. We're gonna go over the top reasons why you're doing it wrong. And we see this very common. A lot of people that come into the clinic, they're like, hey, I've been doing this. And we're gonna show you guys what are the common faults and how to fix them afterwards as well. So the first one is, the most important one is the knee is not straight. So a lot of people will start doing the straight leg raise and their knee's slightly bent and they're lifting this. The reason why that's bad, because it defeats the whole purpose. The leg has to be straight in order to perform that straight leg raise. And that's one of the common tests surgeons will do when you come back into their clinic, is to see if you have an extensor lag, meaning can you get your knee straight while you do this straight leg raise? And that's what you really need to aim for, getting that knee straight when you do this straight leg raise. Because when the knee is slightly bent, it's not engaging your rectus femoris muscle, that quad muscle. Instead, it's just irritating the knee joint and also just irritating the ACL ligament itself. And you're just gonna be overworking the hip flexor, because the hip flexor is gonna be doing all the work doing that when your knee's slightly bent. So that's mistake number one. Mistake number two is that people tend to just swing their leg, use momentum and drive the leg up. And when they do that, they're not engaging any of the muscles. So they're really just using passive structures, maybe some hip flexors through that activation there, but they're really just, swinging their leg up and just really forcing that leg to raise up. And we're not really working on the actual movement itself. We're really working on the activation of the muscles, getting those quad muscles really strong and activated after surgery. And then usually when we talk about that momentum, because a lot of the times people have a brace, makes it easier to kind of swing up. Another mistake that we commonly see is when people do it laying down. So when I'm laying down, I could arch my back and then really create not as great posture to do this straight leg raise. And it makes it easier to do this because when I'm in this position, I don't really need to engage my quad, and I could just use my hip flexor, my low back, to drive my leg up. So that's another mistake that we see with people when it comes to the straight leg raise. Fourth one is not actively contracting. So they're not thinking about using the muscles, they're just performing. So they'll get their knee straight and lift it up and not really engage this. So the big thing with that is sometimes they'll use the electrodes in the quad muscles, and that's what's really gonna help drive that activation. But really focusing on getting that quad activated and really thinking about the muscles doing the action as opposed to just doing the action itself. Let's fix up your straight leg raise. We went over the common things that people are doing wrong. Let's show you how to do it correctly. So first things first, I like doing it sitting up. Laying down, remember we were talking about people start arching their back, start using more momentum. So start sitting up, throw your leg up. I also like to throw my opposite leg up as well. That really is gonna lock out my lumbar spine and really force the muscles to work. So where I'm in this position, before I do the straight leg raise, I wanna get my knee straight. So I'm gonna squeeze my quad, try to think about bringing the back of the knee down to the table or the bench. Now I'm engaged. Squeeze that quad muscle, really feel this muscle working, make sure the knee is straight. From there, be nice and tall and just lift up your leg slightly and come back down. You see that subtle movement? That's all we need to do. We don't need to swing our leg up because now we're not engaging our muscle. So we'll be sitting up, squeeze our muscle, get the back of the knee to try to touch the table or the ground, wherever you're doing it, feel the tension in the quad, feel the tension going down from all the way up to here, and then just lift up slightly and coming back down. When you do this, you want to re-engage every time. So when you bring it back down, reset, squeeze, then lift up. Don't just keep it squeezed the entire time because you might lose some tension. And when you lift up, activating, you're only going so far, and make sure there is no lag. So make sure the knee doesn't slightly bend when you're doing this. Keep that tension the entire time doing that movement. And the big thing is, it's a very subtle movement. If you're unable to do this, common things you got to look out for is, if you don't have the quad strength to make sure you're maintaining that knee straight, maybe you add in, like I mentioned, the electrodes to really engage that rectus femoris muscle to keep that knee as straight as you can, because that's called the extensor lag, when the quad's not strong enough and the knee is not able to be in that straight leg raised position. The other thing is, if you can't get your knee straight, it might be affecting the ability to do this exercise. So make sure you have the range of motion before going through this exercise. But that's how you commonly do the straight leg raise that often gets prescribed. Like I mentioned, not a big fan, but a lot of people do this. It's in a lot of protocols, so we got to make sure you're doing it correctly. So engage the quad muscle, get the knee straight, then slightly lift up, doing it sitting up. You should feel a lot of the muscle down here. If you overdo it, you might be feeling more up here. Really focus more on that rectus femoris muscle. And if you guys have any questions regarding the straight leg raise or any part of ACL rehab, comment below. We also work with clients online and in Southern California area. And if you guys like this video, share it with friends and family. Hit the like button. We are the Basketball Doctors. Let's ball for life.